Today let us discuss one important topic which is not only asked for 4 marks question, but they can also ask as 2 marks question. You just leave about the examination point of view, but it is clinical point of view, it is very important. Why? Because if you don't know the anatomy of the present structure and you don't know how disease occurs, so this is a key area. It is the important structure which involves all the 3 main things in the ENT, and diseases from one place to another place and another place to the other place will occur by this important structure. This is so that is nothing but a Eustachian tube. Eustachian tube, it is also called as pharyngotympanic tube. With the consideration of anatomy, first before going directly into the pathology and the other related how a disease occurs and what happens if the Eustachian tube doesn't work properly, before that you should see what is the anatomy and what are the anatomical aspects and clinical aspects of anatomy. We need to look into the detail. So Eustachian tube connects to what and what. So if you can take the middle ear, for example, this is the middle ear 6, walled box. If you can say, for example, if it is my middle ear, so this is the anterior wall and this is posterior wall. You have a mastoid cells. Here you have brain, and here you have jugular bulb. Okay. The laterally in for the middle ear you have tympanic membrane. The medial wall of the middle ear is by promontory. The promontory is nothing but the coiled area of the cochlea which fits into the medial wall of the middle ear. Okay, that is called as, that bulge is called, we can see from the other side, it is called as promontory. And one important structure that is in the anterior wall of the middle ear, that is one muscle, that is tensor tympani muscle. The tensor tympani muscle, if you become a ENT surgeon, till your death it will come with you. For the other people, it will come till your pre-PG entrance examination. If you write any exam, this question will come. There are 2 muscles in the middle ear. One is tensor tympani, the other one is stapedius. The nerve supply of these 2 muscles are very commonly asked MCQ questions. The tensor tympani, the stapedius muscle is supplied by nerve to stapedius, which is a branch of facial nerve. And the function of the stapedius muscle is, when you hear a loud sound, it will contract the muscle. It will cause contraction of the muscle. It will drag the tympanic membrane. You will have a protection from the loud sounds. If you don't have that protective mechanism, all loud sounds will enter into your ear, and you will have a very severe, disturbance into the ear. Okay, and you come to tensor tympani. The name itself, tensor, it is the tensor it tensors the tympanic membrane. So it is in anterior wall of the middle ear. This is very important, and this is supplied by mandibular branch. Okay, this is supplied by mandibular branch, and this is by facial nerve. So these are 2 important MCQs. They will ask whichever exam you write. Okay, right. Apart from the tensor tympani muscle, one more structure you have anteriorly, that is nothing but our present topic, Eustachian tube. So this is our topic. So from the anterior wall of the middle ear, it goes in where it ends, that is more important. That is what I am concerned. If you can see the nose here, if you can nose here, you have an inferior terminate here and middle terminate here and a superior terminate here. I think if you can remember these three terminates, it is behind the 1.25 centimeters behind the inferior terminate. It opens. Okay, it opens into nasopharynx. So this is from nose diagram. I will show you right now the nasopharynx diagram, where it opens. You put head into the nasopharynx. Okay, you put head into the nose. Then you will look how a nasopharynx will look. So this is, if it is the nasopharynx. Okay. So if he is a kid, you will have one, structure with rugae, that is nothing but adenoid, and lateral walls of the nasopharynx, you have one opening. Okay, that is bilaterally, that is nothing but Eustachian tube. Okay, that is nothing but Eustachian tube. So this Eustachian tube, from here it will enter into the, it will start in the anterior wall of the middle ear. With this, the Eustachian tube, it is 36 mm length, means 3.6 centimeters. Okay. So middle ear, if you can recollect your structures, middle ear, it is bony or cartilage. Middle ear is bony only. So see that, for example, if it is, this is my Eustachian tube, so my ear is bit behind and my nose is in front. So it is connecting my nose, nasopharynx to my ear. So it is like this. Okay. So this is directed forwards. So it is forwards, right? Forwards and downwards, and it is towards medial, right? If you don't understand, again I will tell you. See, this is my Eustachian tube. This tube is my Eustachian tube. So if I put my Eustachian tube into anatomical space, it will be like this. It connects from the ear to my nasopharynx. Okay. So it is downwards, right? So my ear is bit high up and my nasopharynx is bit low. So it is directed downwards and it is forwards. It is going forward like this. Forwards it is going. So it is going anteriorly. So downwards, forwards, and it is turning towards my medial side. Nose is medial and ear is lateral, right? So downwards, forwards, and medially. This is also an important MCQ. If you can put your Eustachian tube into anatomical space, anatomical position, you will understand downwards, forwards, and medially. Okay. So it is 36 centimeters, and the posterior lateral. This is posterior lateral. This is anterior medial side, right? So the posterior lateral one is bony, and anterior posterior lateral is bony, and anterior medial one is, it is cartilaginous thing. It is like elastic cartilage. Okay, right? Now you understand where Eustachian tube is located. Okay, so at least you know where it is located. Okay, it is very easy to write any question related to this. Again, so if I come, Now you know that it is 36 tube. So how it structures? If you can see, if you can take out the entire Eustachian tube, how it looks like, or else you cut it. You cut the tube in between. How it looks? See, you take the nasopharyngeal end. If you can take this, it is a cartilage, right? I told you that the medial part of the tube is always a cartilaginous. If you can cut this, it is like cartilage. Okay. So entire lateral wall is fully covered with a cartilage, and medial wall, half of the medial wall is covered with cartilage, and some part is having a thick fibrous band. And below that you have some pad. It is pad of fat. This is called as Eustachian pad of fat. So this is okay, but here I want to tell you two important muscles which are related to this. Okay, so here are Eustachian pad of fat. Here one muscle is there, that is tensor pallidum. There are three muscles related to this Eustachian tube, that is tensor pallidi, and here one muscle is there, that levator pallidi. One more muscle is there that is related to the Eustachian tube, that is salpingopharyngeus. Tensor pallidi. So it is from tube to palate, levator pallidi. It attaches to the pharynx, to tube. And salpingopharyngeus. Salpingo means tube, and again pharyngeus means it attaches to the pharyngeal muscles. Okay. Here, I want to stress one more point. This tensor pallidi is supplied by mandibular branch of trigeminal. This is again a MCQ. And this levator pallidi, this is by cranial accessory and pharyngeal plexus, and salpingopharyngeal also the same. Okay. So tensor pallidi, nerve supply, he has asked n number of times in the pre-page entrance exams. If you don't know this, don't go to the exam, that's it. Okay. So here one more important point is, like esophagus, the tube is always closed. Okay. Why it opens, how it opens, and when it opens, that is what we need to know. So this is a structure, okay, you should understand. Okay. So tensor pallidi, it is supplied by mandibular nerve, and levator pallidi and the salpingopharyngeus, it is supplied by cranial nerve, cranial accessory nerve, okay, through the vagus, right? And here, when it opens, why it is there, and what it is, and how it functions. And before that, you have seen the nerve supply, and the tensor tympani muscle, it is also called as dilator tube. Means when it contracts, it will open the tube. Okay. And why it opens, that is more here. For example, this is a tube, and this is the middle ear. So this is the nose. Okay. The middle ear is opened only with Eustachian tube. Middle ear is a closed cavity. It doesn't have any other opening. Of course, if you have a perforation in the tympanic membrane, I can say that you have a perforation and you have opening from to exterior. But if you have a intact tympanic membrane, there is no opening. The middle ear is a closed cavity, so you cannot, anything cannot escape to anywhere except this Eustachian tube. This is the only opening where it connects to nose. Nose means external environment. So whatever the pressure in the middle ear contains air. Okay, other than air, if anything you have in the middle ear, it means you have some disease. So if you have air in the middle ear, apart from this, you don't have anything. Of course, a lining epithelium with the mucous glands, that is different. Now we are concentrating only on this. One more important point here is, what is the lining epithelium of middle ear, and what is the lining epithelium of nose, and what is the lining epithelium of Eustachian tube. So if you know the function, you can understand what is the epithelium also. So for example, if you have any disease, or if you have anything, or if you have a pressure changes, okay, then the Eustachian tube sometimes locked. All of you, while watching this video, just close your nose and try to swallow. All of you, please close your nose and try to swallow. So you will have a dub sound in the tympanic membrane. That is what Eustachian tube work. Okay, so it is equalizing the pressure between the nose or the external environment to the middle ear, and if you can see, so that is the pressure equalization to the environment to the this middle ear is the function of this Eustachian tube. Okay, and one more thing, for example, due to any disease, if middle ear is, it has a fluid or whatever, the bacteria or whatever, so you have a ciliated epithelium in the Eustachian tube. This cilia will beat towards the nose, and as like a conveyor belt, whatever the bacteria, whatever the fluid, whatever the material, it goes out. So it will wash away all the material in the middle ear. Okay, so it is the lining epithelium, that is ciliated columnar epithelium, which is equal to the nasopharyngeal epithelium. Okay, right. And one more thing here I want to tell you is, if you can see the nasopharyngeal end of the Eustachian tube, if you can see the nasopharyngeal end, I told you this is the Eustachian tube, and you have a cartilage over it. What this is called, a cartilage over it, and if you can see the, this is the tube, and this is the cartilage over it. Here one important structure is there in the nasopharynx, that is called as fossa of Rosenmuller. Okay, this is called as fossa of Rosenmuller. This is somewhat hidden area, and nasopharyngeal carcinoma will start with this fossa of Rosenmuller. So this is a seat for nasopharyngeal carcinoma. I want to stress two important points which are most important, most important for the MCQs and as well as the examination point of view. I don't know why all foreign exams, they will start with this question. If they want to put any ENT exam, they will start with this. I want to stress 2 points. If you have a Eustachian tubal dysfunction in a kid, there must be some adenoid which is pressing over the Eustachian tube opening. So that's why, so you have locking of this tube. Due to locking in the middle ear, you will have a fluid, and there is a retraction of the tympanic membrane due to imbalance of the pressure in the middle ear. So you will have a tympanic membrane is retracted. If you see the retracted tympanic membrane, it means that there is a dysfunction of the Eustachian tube. If you see the tympanic membrane, it means that there is a dysfunction. If you see the fluid, the other day we have discussed otitis media with effusion. If you see fluid in the middle ear, it means that the Eustachian tube is not working properly. It is not letting out the fluid to the outside. So you should have an idea on this, and you should examine the nasopharynx also for adenoid. Okay. And I want to stress here, this is my favorite bit also, favorite MCQ also. If the same tympanic membrane retraction or middle ear fluid in a simple word otitis media with effusion, if an adult patient comes to you with the otitis media with effusion, remember and remember till your end of the day. It must be a nasopharyngeal carcinoma from the fossa frozen molar. If a child comes to you with the Eustachian tubal dysfunction, look for adenoid. If an adult comes to you, look for nasopharyngeal carcinoma. Okay? Just if you see the ear and there is some fluid or there is some dull tympanic membrane, you just take these antibiotics and come back. You are doing a blunder. Whenever you see otitis media or any fluid or any retraction in the tympanic membrane, if he is adult, don't forget to examine the nasopharynx. You may miss the nasopharyngeal carcinoma. Okay? If you can miss it in the early stages, he will present in the late stages, and if you diagnose also, no use. Okay, that is the difference between you and the other doctors, as a ENT surgeons and other doctors. So you should know what it is, why it is, and what should you do. Okay, at least you should know this. If you have an idea what a popular saying, eyes can't look where the mind doesn't know. If you know this, you will examine the nasopharynx. If you don't know this, you cannot. Okay. You leave about the pre-PG exams. Okay, now you come to third year. So for your upcoming exams, there is one question always is a head hot cake. If I set the question paper, damn sure I will give you this question. And this is also a, for my forefathers, this question is coming into the exams. That is the difference between adult and pediatric versus adult Eustachian tube. There is some differences between the adult Eustachian tube and the pediatric Eustachian tube. That is very, very important, and this is the topic of interest. And this is you want to know, and you have to by heart, and you have to produce all the points for full marks. Okay, right. So first, length. If you take the length, the adult Eustachian tube is 36 mm, but whereas in case of pediatrics, it is only 12 to 18. Between 12 to 18 mm of length only. Okay, but whereas the adults, it is double. Okay, it is 36 mm length. And I forgot one important point. This is, for example, if this is the Eustachian tube, I think you can see properly, I guess. This is bony end and this is cartilaginous, and there is a small constriction between the bony and cartilaginous thing, bony and cartilaginous tube. There is a small narrowed part that is called as isthmus. Okay, isthmus of the Eustachian tube. So this is the narrowest part. Okay, and you have one more isthmus in the external artery canal also. Okay, so any narrowed part, you can say that it is an isthmus. Right. So the length of the adult is 36, and pediatrics the half, means 13 to 18 mm. And one more important point, I told you, for example, this is my Eustachian tube. My Eustachian tube is like this, and this angle is 45 degrees in adult. 45 degrees in adult and only 10 degrees in children. So that's why while they are having milk whatever, if it is not in a proper position and their muscles are not fully developed and the Eustachian tube is not fully developed and the angulation is less, okay, and it is much wider when compared to adults, means proportionate wider, and the fluid or the milk may regurgitate into the middle ear and you will have a frequent infections. So this is the point of interest. So that's why you have problems with the Eustachian tube in case of children. Okay, and the angulation for the isthmus also, there is no angulation for, for bony and cartilaginous part, there is slightly some bend is there. So adults there is the bend, the angle at the isthmus, but there is no angle for the pediatric Eustachian tube. And one more point is here, when we discuss, when we can cross diagram this, you have a Osterman pad of fat which protects from the regurgitation of the food and which protects the Eustachian tube. It is very less density, and in case of adults it is very dense. Okay, and the density of the cartilage, okay, it is much thicker in a case of adult and it is very slender in a case of the kids. Obviously it is much slender. Okay, and if you can see the bony versus cartilaginous Eustachian tube, obviously the cartilaginous part is lengthier in a case of adults, but in a case of pediatrics, bony part is lengthy. Why? Because he is growing means the cartilage grows more. You just remember, this is most confusing point. Which is lengthier in a case of adults and children? First comes B and then comes C. So B is bone. So if I am a kid, my bone is lengthy. If I become adult, so I will first B and later on I will become C, right? First B comes and later on C in alphabetical order. So for kids B is lengthy, means bone is lengthy, and for adults cartilage is lengthy. So you remember like this. So you cannot confuse. Half of the people, they lose their MCQ questions due to confusion. They might have read somewhere and the problem is they can't retain and they confuse and they lose their marks. Okay, so to avoid this confusion, you make it a small things like that. Okay, so this is the 5 points: length, the direction, and angulation at isthmus, and bony versus cartilaginous tube, and the density of the cartilage, and the Osterman pad of fat. All these 5 to 6 points you have to write. And this cartilage, there is again a elastin cartilage which connects the lateral and medial half, and this is the elastin. This is called as elastin. This elastin is much wider in the adults also. So when it comes to the protection, when it comes to the functions of the Eustachian tube, what are the functions? If you remember 3 functions, this question is again an important question. They may ask for 2 marks or 4 marks question. If they ask the functions of the Eustachian tube, first one is pressure equalization, the second one is protection, the third one is ciliary or secretory activity. Okay, what is pressure equalization? For example, if you are landing from a Airbus, okay, A380, which is double-decker bus, flight. If you are landing very rapidly, okay, in those cases, the middle ear can't equalize the pressure. There will be a locking of the tube, locking of the Eustachian tube, and your tympanic membrane will be retracted, and there will be accumulation of fluid due to retraction, and you will have a severe ear pain that is called otitic barotrauma. So if you can able to equalize the pressure, so you will avoid the otitic barotrauma. Remember, this otitic barotrauma sometimes leads to serious hazards like sensory nerve hearing loss. I have n number of cases. I have seen n number of cases of barotrauma because the lack of a small, idea or knowledge. While a rapid descent or a descent during the flight journey, you just chew something, or you take some juice and have some fluid with the straw, or you chew the bubble gum which you chew in the normally classrooms. Okay, so while if you chew the chewing gums, actually you will open the Eustachian tube, it will maintain the pressure and you can avoid the barotrauma. So that is the pressure equalization. In case of large adenoids and any mass, you cannot equalize the pressure. Okay, again that will be a problem. Right, the abnormalities will later on we can discuss. For this, the main function is pressure equalization. The middle ear pressure should be equalized to the atmospheric pressure for the proper conduction of the sound, for the proper movement of the ossicles and proper function of the middle ear. If you have any problem locking of the Eustachian tube, there will be accumulation of fluid, a transudate will occur and you will have a problem. And if you have a fluid, it will cause conduction of the sound and you will have a conductive hearing loss. Okay, so first one is protection and pressure equalization. Second one is protection. How it protects? If you have a loud noise, the tube will be open and it will transmit that sound to Eustachian tube rather than to the inner ear. So it is the protection of the ear. And the third one is ciliary activity. So we discussed that it has a ciliated columnar epithelium. It continuously, whatever the middle ear, bacteria or whatever the agent is there or fluid is there, it will, take it out. So these are the functions and anatomy. So this is very, very important. You should learn the diagram what I have shown, the osteum pad of fat, fibrocartilaginous, tensor tympani, all these muscles. You should draw the diagram. You should produce it in the paper if you have an exam. Okay. So if you can draw that, you will get very good marks. Okay. Always, as I told you, the diagram gives extra 1 mark. Okay. So here I will stop this topic, and in the next class I will come with you the abnormalities of the Eustachian tube and how you do a function test of the Eustachian. Okay. Thank you very much. Have a nice day.